Welcome, everyone. I am Allison Small, Chief Operating Officer at SCRS, and this is Innovative Methods to Revolutionize Your BD Practice.
David, let's go to you.
Hi, everyone. My name is David Rosenbaum. I am the Managing Director of Rosenbaum Group, a niche biotech CRO.
So normally, if we would met in London or as planned in Lisbon, I would definitely ask the audience to raise a hand who is from the site business, who is from the CRO business, and who is from pharma business, just to know what part of the business you are actually representing. But unfortunately, we cannot do this as planned. But if we speak about the business development, it's especially a tactic needed for the sites because pharma does not need it. CRO, it's a kind of a different part of the business. So your clients mainly are the pharma companies, and for us, for the sites, we have various clients because the CROs, the biotech, the pharma itself. So there's more to do. However, I think that for all of us, the time we are living right now, the time of pandemic, is really challenging and has a strong influence on all the activities in clinical research. Just asking the panel right now, what has changed? I mean, we know that we cannot meet anymore like we used to, and just arrange a meeting, just meet for a coffee or something and discuss with the potential clients or keep the client relation on a specific level. There are a lot of new places that we can visit and look for the opportunities. Trial site news is a service, or you can be a part of their newsletter, and there are a lot of interesting information in summaries, so you can see who is working on what, and depend not only in COVID but also in other indications. So I think that the sources that we have online are really strong, and we need to utilize it more. Not mentioning all the clinical trial browsers like clinicaltrials.gov or EMEA tools that are actually listing a lot of interesting and very good information about the studies. But I think it's all about when you need new studies from new clients. So we still need to focus on the existing one, and it's still challenging once you cannot, just meet physically. What do you think, guys? Sorry for a long comment.
Well, I think you bring up good points as far, a lot of that is data mining. And so you're searching on all these different platforms to find potential studies and contacts to reach out to. My experience with ZymeWire is there is a lot of valuable data there, but it does take a lot of time to mine through that data. And you're also going to send out a lot of messages and emails and contacts that are never going to be responded to. So it's kind of like fishing. You just got to keep putting more lines out there, and hopefully you get some bites. But and I think you also have to have dedicated resources of people that have the time to actually go through and find and mine these contacts and reach out multiple times. But yeah, I'm curious. Perhaps David or Ivan, have you guys used any of these types of tools with any success?
Actually, I would like to, because you gave me so many points to talk about. So, Rick, I will start now with this ZymeWire. You said you have to have time and resources for that. When I started my consulting business in 2019, I have established the company in October 2019, and my last meeting was the SCRS in Poland. I don't know, Piotr, if you remember.
Of course I do.
Yeah, and then everything literally stopped. I had to cancel travel to a conference in Israel. I had to cancel a conference in London. And then I was like thinking, okay, what to do? So all the platforms that you have mentioned, clinicaltrial.gov, that's excellent platform. But when you are searching for a particular information, if you are searching for sponsors who you can approach, that's not going to work. ZymeWire, and the same thing on LinkedIn, you can send millions and millions cold emails and cold calls and whatsoever. If the people are not interested, you don't get a chance with them. So I was thinking, like, I don't have that time. I have very limited resource on the funds, on the money. because I have started my business with my own savings after I have quit a position in the site management organization. And I was like thinking, okay, what to do? So when I was recalling the last meetings, I was walking around the whole conference room. There were like 60 people and always handing out the business cards. And guess what? Really, like out of 60 business cards, maybe I maintained only one contact. So, and what has happened now? You are stuck at home. What you do in the morning when you brush your teeth, when you sit on the toilet, when you are overloaded with sending out those emails or working on some trackers and stuff, you just go to YouTube. So what I have decided to do is just a simple thing. I have made my own YouTube channel, and this is how it started. And every once a week I make like 10 minutes video that you can watch about clinical trials while you are brushing your teeth, while you are making your morning coffee, while you are cooking. And I'm just sharing my experience because this is what COVID made us realize. We have very precious time to spend now more with the family, and you don't want to waste it on some useless things such as lead generation and so on. So for me, sharing my experience, the proper approach at the moment, and so far it's working great. You have to have a great video because that's the only way how you can keep the contact with the clients from the other opposite side behind the camera. And you have to entertain them just like we do at this conference right now, because you can this is happening also on a live conference or on the every virtual conference. If the conference is boring, what you are going to do? You are going to scroll in your LinkedIn feeds and you are listening only with one ear. So, and that's why it's very important to send out the message that you have an added value, either if it is as a site, if it is as a CRO, you can add to the value of your client that they are searching for. And the best thing is when you, for example, make a video content from your site, sharing what types of studies you are doing, how you are communicating with the patients, how you are discussing the ICF with the patient on the site. This is very interesting and it makes impressions. Just as I do, for example, last month I have done site selection visits in Turkey. I have shared the information, how it went, what they should be aware of. Now I will be in the upcoming weeks, I will be sharing my experience on how we have done our first submission in Turkey and what is the best approach to submit in Turkey. Because for many sponsors, this is a very interesting country, but yet they don't have the experience. So sharing experience is very important, and not to waste your client's time is the second important thing. And also, I would say, if they are interested in working with you, they will come along because you have entertained them, you have left the message that you are interesting and experienced person, and voila, you have the recipe for success. At least so far it's working for me.
Well, it's definitely very interesting. I think that one of the challenges that a lot of sites, and of course I'm speaking from the sites perspective, which is really just where I come from. We're not entertainers, and so it's not that for some folks like yourself, creating a YouTube video and making it exciting and something that people are going to watch, that probably comes natural to you. But I think that's a real challenge for a lot of site owners, a doctor, a nurse, a clinical research coordinator. And so, I think it's a great idea. Don't get me wrong. If you can bring those personal experiences into the marketplace and share those, I think it's very valuable. It doesn't always have to be a video. It can be a post about something you accomplished as a site. And, I think to the point earlier about not seeing a lot of sites on LinkedIn, I think that's further proof that there is a lot of room and a lot of space for you to get your messaging out there. And there's a lot of tools on the back end of LinkedIn that really help you target specific people and groups, pharmaceutical companies, CROs. And so, yeah, the messaging is very important. And there's no question about that. I think how you get that messaging into the marketplace, you can use YouTube. I have seen a lot of success with certain sites and site networks that have invested in that presence on LinkedIn, and it has paid returns to them. And I think one last point that I would make is that one of the things that I often hear sites and especially the investigators commenting on is, well, we spent X amount of dollars and we didn't see any return. And I think you have to believe in the concept of impressions in the marketplace and getting your messaging out there. And it takes months. It doesn't have, it's not like you spend $1,000 and all of a sudden the phones are ringing off the hook. This is a long-term strategy that you have to continue to get that messaging out there, and you have to let that cultivate and grow and turn into people noticing you. And over time, it does start to pay you back.
Yeah, great point, Rick. Great point.
You actually touched a very interesting point about being patient. You know, it's like if you want to see results, it's in a short term, you can hire a salesperson and just hopefully this person will help you to generate more business. But unless you are not patient and you're not consequent in your activities, this is very important, because whenever people are thinking that, you know, placing anything on LinkedIn or any other social media related business will give you immediate response, it's not this. Absolutely, it's like with the newsletter. Why you are sending the newsletter? Newsletter is only a tool to remind people that, hey, I'm here, I'm doing my business in this and that way, these are my good results. And whenever some decision maker will step into your newsletter and okay, I do remember about this company. Let's send them the feasibility. Let's see how they can perform this part or not. And one more comment to let's say high-level digital tools. We are trying right now to communicate with our doctors by sending a short videos. So in my organization, we have a lot of doctors, and we have 16 units, and only a couple of them are dedicated to run the clinical studies. And in order to have a proper number of internal referrals from other physicians, we are sending them short videos just as a kind of a reminder about the study, for example. And I do believe that this might be a kind of a future, a different type of a newsletter, because it's not email, but this is something that you see a real life person speaking to you in a video. Ivan, if you can share something with us, it will be really good to hear your voice as well.
1 year ago, I would say about BizDev in a different terms, because I have a site that is directed by, kind of a little bit introverted managers. And all of us, and me personally, believed and continue to believe that if you have a good product or if you do a good job, you kind of don't really need to go and reach out and to find some new opportunities, because they will come to you themselves because you're so good. And COVID-19 changed quite a lot in that sphere, because we couldn't conduct those conduct those trials in those indications that were usual for us, and we needed to find our new path. And after that, we had to reach out and to get that message listened to our customers and to CROs, to the sponsors. So at some point we made that pivot, and we became kind of not internal medicine specialized research center, but infectious disease specialized center. Of course, because of COVID-19, but it was it had to put a lot of effort from our side and to become more agile, and to we needed to understand that, that case scenario planning should be the part of our life, of our everyday life, and that is what we didn't do before. And today this is absolutely must to orient that that VUCA world has become much more VUCA more volatile, more uncertain, more complex, and more ambiguous. And clinical trials tremendously were complicated but by all those COVID associated issues. So we had to transform ourselves. And beside that, we moved to another indications. We also realized that we need to find more other opportunities to diversify our opportunities and our sources of revenue. So we decided, we looked around and found that oncology clinical trials, for example, that we didn't conduct at our site, didn't suffer from the COVID-19, at least in Ukraine, to that extent, like internal medicine, like protocols in internal medicine. Mm-hmm. So we decided, why not to try to switch to oncology? And we tried, and we found another hospitals where clinical trials were not conducted, and started to develop research site there, and it was quite successful. We also thought about starting consulting and consult more, and it was also quite effective for us. It diversified our abilities. And we tried to find where we can put all those human powers that we had, and it was not temporarily used at our sites. So we outstaffed our workforce, and again, it was new for us, but it worked, and it works. And so yes, we changed a lot. Now our sites and our whole organization, let's call it SMO, it behaves differently, it looks differently, and our approach to business development has changed very significantly, because now we don't only build quality services. Now we indeed use all those resources that you mentioned: LinkedIn, social media, direct contacts, reaching out, and it works. So I think that COVID-19, on the one hand, hindered the development for many of us, and on the other hand, it helped us to find new paths, new opportunities, and new spheres in clinical development, in clinical trials area.
Some sites have actually been successful because they have been able to move into COVID-19 programs and so on. So they actually done better. But we also know we have lost sites, and they don't know when it will follow us somehow, at least during 2021 still, in some way. And I think that might be important, but maybe Piotr, it would be good to get some perspectives from, we have quite an audience here.
Yeah, that's very good point, Hans. Thank you so much. I think, we share a lot from our side.
I would like to add something to this because Hans gave me great point. So first of all, thank you to Roman for the comment on the rare diseases. Thank you, I have read that. And the second thing, so Hans, when I started my consulting business, actually I started exactly doing the BD and searching for feasibilities for the sites. And you should have one thing on your mind when you are hiring someone that is doing BD for sites, because this is one of the most challenging jobs to do. I have, after 15 months of bringing the first feasibilities to the sites and getting paid, I have realized this is not going to work, and I had to transfer And that's when I have established practically the CRO services, niche CRO services for biotech clients in Turkey, Bulgaria, Albania, and in the Balkan region. Why? Because the whole process of BD and bringing the new study and new projects to the sites, it is so fluctuant. I mean, like, you have feasibility specialists, you have the whole BD process, you get the feasibilities which are not awarded, the pre-awarded feasibilities, then you get the awarded feasibilities part. By that time, you get to the completion of the feasibility questionnaire, you get to the process of site selection. Literally 12 months passes like nothing without realizing. And then, practically the BD process is like, yeah, when we get a project, you get the revenue from that. I've heard this from the sites. I've heard this from the from the CROs with whom I have been working for the business development. It's just not going to work. So, to anyone who is considering making business development for the sites or in general, just have this in mind, because I have burned myself personally and almost burned down the whole business I have just started at the beginning of the COVID-19. So that's very challenging. I mean, if there are people who would like to talk about this more, I will be just happy to share more experience. But really, this is one of the most difficult tasks to make, or to make happen successfully, to bring the project to the site, because there are so many people in between the start of the feasibility and the site initiation that many people, they just don't see it, and they don't realize how complex the whole process is and how hard it is actually.
David, can I ask you a question?
Yes.
And what do you think about outsourcing of business development function for sites? Because I think that that kind of business development issue is not what we medical professionals were taught to manage and to understand and to perform in a good way. What do you think about finding companies, maybe like your company, to outsource this function? Would it be effective, and would it be useful for sites?
Well, Ivan, there are several factors you have to consider. So first of all, if you are going to outsource the business development activities to someone external, you either have to make sure that this person will be working only for you, because if they are making business development for other sites, you can be more than sure you are not going to be this person's priority. I see this on other freelancing projects that I'm working in other indications or other specialties, not the business development itself, but I was doing it, and I'm sharing this from my own experience. The second thing, if you are hiring BD person as a site, you cannot expect that you will magically going to receive new projects in 1, 2, or 3 months. Really, like, from my perspective and the experience I get at the moment, the shortest period from the beginning of the work of the BD to getting the projects is at least 12 months. So you have to consider very well, do I have that time and resources to pay to the BD for 1 year? If yes, then okay, go for it, but you will not get that much revenue out of it. What I would suggest to you is really starting to make this personal touch. Contact the CRAs you have been working in past. They may be on some new positions. They could have changed the countries. They can be clinical team leaders somewhere. This is how I maintain the contact with my sites, with whom I was working as a CRA, and now with whom I'm working as a CRO, because when I get the feasibility, I go first to the sites I've been working with, and then invest in LinkedIn, make some interesting content, as Rick said. Share your experience. What are the projects you are working with? For example, there is a site network of Czech and Slovak research centers of Michaela and Lucia in Czech Republic and Slovakia, who are doing this very successfully. Every once in a week, they are sharing their experience. What are the new projects, new indications? What are the studies where they enrolled first patients? This is what the sponsors are looking for, and also what the CROs are looking for. And then very easily, then you will get the higher probabilities to get engaged. For example, one of the things I would like to share with the trial opportunity portal of the SCRS. I have been trying to work with it. It's not working. My apologies. Please don't ban me from the next conference. I'm just giving a place for opportunity. Let's make it work more efficient. Also, there are other CROs who are looking, like, for example, Oreo from Pfizer. And also I have seen someone else from Parexel. Like, there are people from the CRO business with whom I have been trying to talk to in the conference in 2018 in London, and there was not that much feedback, even that we have tried to maintain the contact and the communication. So rather than investing in some external person who will do your business development, just look into the connections you have in your LinkedIn, because you have many people here in the SCRS. There are many people who can make the work happen. Like Oreo is very, very efficient. The whole Pfizer team, they are trying to push things forward with the sites from SCRS. I see also, for example, Cineos are making some kind of efforts. The same goes to Parexel. So you have the network, you just have to analyze with whom you have the good relationships, which can move forward the success afterwards for getting the new projects and the new trials to your side, in short.
So I think to summarize here to some degree, we're talking about having to put in effort, and work into your BD strategy. There's a lot of challenges with all these different platforms. We've also talked about diversity, which Ivan, I think is a great point, that opening yourself up to different types of work, especially in these more challenging times. But I think essentially sites have to be willing to invest. If you're thinking that doing a good job, unfortunately, is going to bring more work to you in this industry, for some reason that's not typically the case. I know several times we would be a top enrolling site and have excellent quality data for a CRO, and we'd find out that the next phase of the same trial went forward without even a phone call to us to participate. And so I think maybe we're the only industry where you can do a fantastic job and not get repeat business. So it just lends itself even more so to the fact that you have to put resources into getting your name out there. David, I love some of your ideas as far as the personal touch. I think getting a doctor to shoot a quick video, even if it's just a minute or two long, and it's on a cell phone. I think the more homemade the video looks, actually, the better. The more professional, the quickly people just scroll through. Oh, there's some professional commercial. I don't want to see a commercial. I want to have a doctor talking to me on a cell phone and getting your name out there. So just kind of wanted to, there's a lot of great ideas and great thoughts here. Just kind of summarize that I think at the end of the day, it does require effort in all these different areas.
Thinking about the doctor involvement, I think there's one more point to add to this discussion. What we observe is whenever we speak with the clients, you need to have this at least initial relation with the client. We offer kind of a service that whenever they have a new study coming in and they need any medical support in either understanding the treatment option in our country or the patient path in the medical system, they can reach out to us, and before they will even decide to have the study in Poland or in the region, they have an option to discuss with the specialist in this medical field. Okay, guys, and any voice from the audience, because we are speaking a lot. Like it's a BD session, guys, so you need to accept it. We will speak a lot.
Yeah, there are many comments. Vivian had an excellent comment about keeping in touch with your PMs and CRAs.
Exactly, with the CRAs, David. I think this is a very good point, because quite often, what I observe from my personal perspective is that whenever you're reaching out to the people on the higher level, I mean, high positions, either they don't have enough time to check LinkedIn or to answer your questions. So if you can get the nice contact with the CRA involved in the study, or at least know the organization, this person will give you some tips who you should really reach out to, because they are more open. They are, CRA is a relatively entry level position, relatively, not, undisputing this. This is this amazing position. We love you, CRAs. Yeah, this is true. So, but I think it's a very good source of information for us to learn about new potential studies. Not mentioning your own performance. If you're good in this, what you're doing, this is definitely the best business tool. Is whenever you deliver the promised number of patients in the study.
Yeah, and definitely from CRO perspective, that once you have good experience with your sites, for example, such as your Piotr or your Ivan, they just keep on coming back, because afterwards, for example, I talk from my personal experience. I'm a niche CRO and I have to work 150% effectively. So I have to spend short time on feasibility, and I have to make sure that I will have a site that will be able to provide and randomize the first patient into the study, just to highlight the work that we are doing. So it's sort of a teamwork, and that's why the more closer touch you have with your CRAs or the smaller CROs, the better for you, because then they will bring you continuous